Today we'll be discussing tobacco cessation as a health behavior, why it's important to promote, and how U.S. cessation campaigns have drawn on health behavior theories. In particular, we'll highlight the trans-theoretical model of behavior change, its critiques and strengths, and compare it with other theoretical approaches. We analyze one excellent, one average, and one poor campaign, looking at a specific ad from each and how effectively they apply or fail to apply behavior change theory. Finally, we'll consider which theoretical framework best supports effective communication strategies for smoking cessation. Cigarette smoking is the leading cause of preventable death in the United States, contributing to cancer, heart disease, and chronic respiratory illnesses, according to U.S. DHS in 2014. While smoking rates have declined, about 29 million U.S. adults still smoke, according to the CDC in 2022. The benefits of cessation are immediate, as risk of heart disease drops within weeks and life expectancy improves with sustained abstinence, according to the U.S. DHS in 2020. Tobacco use is not evenly distributed across the population, with higher prevalence among low-income individuals, rural communities, and people with mental health conditions, according to the CDC in 2022 and Jamal et al. In 2018. These disparities make smoking cessation both a health and equity priority and highlight the need for theory-based behavior change strategies. The trans-theoretical model, also known as the stages of change model, was developed by Prochaska and Velicer in 1997. It describes behavior change as a progression through several stages, including pre-contemplation, contemplation, preparation, action, and maintenance. The model suggests that interventions should be tailored to an individual stage in order to maximize success. For example, someone in pre-contemplation may need awareness raising, while someone in preparation may benefit from setting a quit date and choosing a nicotine replacement therapy. However, not everyone agrees with this framework. West, in 2005, has argued that the boundaries between stages are somewhat arbitrary and do not always capture the messy reality of quitting. Many people cycle through quitting and relapsing, smoking intermittently, or maintaining abstinence in ways that do not align neatly with the 5 stages. This complexity raises questions about how useful stage-based tailoring really is for tobacco cessation interventions.
Tobacco cessation campaigns are designed with specific audiences in mind. Current adult smokers are the most obvious target, especially those who lack motivation or need additional support to quit. At the same time, prevention efforts focus heavily on adolescents and young adults, since nearly 90% of smokers start before age 18. Low-income populations and Medicaid recipients also carry a disproportionately high burden of tobacco use, which requires campaigns to specifically address barriers like access to care and resources. Overall, evidence shows that tailoring campaign messages to these groups significantly increases their effectiveness in reducing smoking behaviors. Next, we will discuss tobacco cessation campaigns and why these certain campaigns were either excellent, average, or poor examples when targeting the specific audiences that were mentioned previously. To see theory in action, one of the most influential U.S. tobacco cessation campaigns was the CDC's Tips from Former Smokers campaign, which first launched in 2012. It was grounded in social cognitive theory, which emphasizes the interaction between personal beliefs, behaviors, and environmental influences. The campaign used real-life testimonials to highlight the harms of smoking, with the aim of changing attitudes and increasing self-efficacy for quitting. One example is the 2016 ad featuring Christine B., a woman who developed oral cancer after years of smoking. Her ad shows the physical toll of surgery that altered her ability to speak and eat. This message is both fear-based and supportive, showing the stark consequences of smoking while also encouraging smokers to quit for the sake of their loved ones. This combination of emotional appeal and self-efficacy aligns closely with social cognitive theory and contributes to why this campaign is considered a success.
The FDA launched Every Try Counts in 2018, a motivational campaign that ran across point-of-sale retail locations until 2020. Its primary goal was to reframe relapse as a normal part of the quitting process and encourage smokers to keep trying. Unlike fear based campaigns, it leaned on positive reinforcement with the message that every attempt to quit matters. While the campaign had strengths, evaluations found it was only moderately effective. Smokers reported noticing the ads, but evidence of sustained quitting was limited. Research also had important limitations. Most findings were self reported, and the campaign was tested in only a handful of counties, which limits generalizability. Overall, every try counts reflects how motivational approaches can resonate with some audiences, but its restricted scope meant it had less impact compared to campaigns like CDC's tips. Another critical angle in tobacco cessation is access to healthcare benefits. Medicaid recipients smoke at nearly twice the rate of the general U.S. population, about 32% compared to 17%. Medicaid technically covers all FDA-approved cessation therapies, which should make it a powerful tool for reducing disparities. However, studies show this potential has been underutilized. For example, a Kansas-based evaluation found three major barriers. Physicians frequently failed to prescribe cessation treatments, many patients were unaware of their coverage, and in some cases, pharmacies did not fill prescriptions even when they were covered. Among these, lack of prescribing was the most significant barrier. This highlights a systemic failure. Medicaid offered resources, but because there were no strong calls to action, public facing ads, or provider level accountability, the benefits largely went unused. It's a clear example of how even well designed policies can fall flat without effective communication and implementation strategies. Looking across the three campaigns, we see clear differences in how theory was applied. The Tips from Former Smokers campaign aligns with social cognitive theory through its strong use of modeling, outcome expectancies, and self efficacy. Every try counts fits more closely with the trans theoretical model, supporting repeated quit attempts, though it lacked strong engagement and did not address prevention among youth or disparities among low income groups. Medicaid coverage efforts reflect weak or absent theory application, with systemic communication barriers that prevented effective use of available resources.
Of the theories discussed, social cognitive theory stands out as the most effective framework for tobacco cessation campaigns. It emphasizes personal beliefs, social modeling, and environmental influences, which directly shape smoking behaviors. The Tips from Former Smokers campaign demonstrates how real life testimonials can both warn and empower smokers. Applied to future campaigns, social cognitive theory suggests the importance of diverse role models sharing quit stories, highlighting not just health but also family and financial benefits. Interactive digital spaces could extend the modeling effect, while campaigns should also link directly to practical resources like quit lines and free therapies. Together, this approach strengthens both motivation and access to cessation support. In conclusion, smoking cessation remains a critical public health priority. The trans theoretical model offers a helpful framework, but as West and others have noted, real behavior change does not always progress in neat, predictable stages. Campaigns like Tips from Former Smokers show how social cognitive theory can effectively influence beliefs and self efficacy, while Every Try Counts demonstrates moderate impact with stage based approaches. Medicaid coverage highlights how systemic barriers and weak communication can undermine even well designed interventions. Ultimately, the best approach combines strong theoretical grounding with system level supports, ensuring smokers are both motivated and equipped with the resources they need to quit. Together, these lessons remind us that lasting change comes from pairing effective theory with system level support, so smokers are not just inspired to quit, but truly equipped to succeed. Thank you.